Should you get your wisdom teeth removed? Well, it depends. But let me go into more detail and I'll give you 4 reasons why you should get your wisdom teeth removed. And I'll leave links to some publications from the American Association of Oral and Maxillofacial Surgeons, AAOMS, down in the description.
Hi, I'm Dr. Rich. I'm a general dentist with over 25 years of experience, and I'm teaching you about dentistry and teeth so you could have a very nice smile.
So what are wisdom teeth? Wisdom teeth are the last set of molars that erupt in your mouth, usually between the ages of 16 and 18. Since they erupt behind your second molars, wisdom teeth are called third molars. Most people have 4 wisdom teeth, 1 in each corner of their mouths, but it is not uncommon for people to have fewer than 4 or even more than 4 wisdom teeth. Here's an x-ray of a patient of mine with only 3 wisdom teeth. This x-ray of a patient of mine shows 7 wisdom teeth. That's the most I've ever seen. The oral surgeon was able to remove all 7 wisdom teeth in one visit. And because they erupt in the back of your mouth, most people don't have enough space for them. If they can't erupt properly, they become what's called impacted. Wisdom teeth can get hung up on the teeth in front of them, or they can be malpositioned. They can be soft tissue impacted, which means they are only covered with gum tissue, or they can be partial or complete bony impacted, which means that they are partially or fully covered by jawbone. Wisdom teeth can also be vertically impacted, which means the tooth is straight vertically, but it's not erupting, or it can be horizontally impacted, which means the tooth is lying on its side in relation to the other teeth in the mouth, or at any angle in between. Your dentist will take a panoramic x-ray to check your wisdom teeth. So reason number 1 to get your wisdom teeth removed: they can cause an infection. This is most common to occur when a wisdom tooth first starts to erupt in the mouth. The top of it will be partially covered with gum tissue, and a piece of food can get trapped underneath the flap of gum. Since the tooth may not ever fully erupt, this situation can continue to occur until you have the tooth removed. Reason number 2, the dentist can't reach your wisdom tooth to fix it. Sometimes because of how wisdom teeth are positioned, it's difficult for you to clean them at home. This can lead to cavities or periodontal disease. If it's a cavity, sometimes it's just not possible to repair the tooth with a filling. There's not enough room in your mouth to get the dental drill to the wisdom tooth to repair the cavity. When that happens, I will recommend that you get the tooth removed. Same with periodontal disease. It may be impossible to perform scaling and root planing on the wisdom tooth, and you can't properly brush and floss it at home. Again, I'll recommend getting the wisdom tooth removed. Reason number 3, damage to the neighboring teeth. It's one thing if a wisdom tooth is the tooth that gets a cavity or gum issues. When a wisdom tooth is impacted, it's usually the tooth in front of it that is causing it to not erupt. If the wisdom tooth is impacted, over time the pressure of the wisdom tooth against the second molar may cause the second molar to be resorbed. If the wisdom tooth is partially erupted, a cavity can form on both the wisdom tooth and on the second molar. If the damage to the second molar is severe enough, it may need to be removed as well. Even if the wisdom tooth is fully erupted, it may be difficult to keep clean. If you can't brush and floss it properly, it can lead to gum disease as well as cavities, which may also affect the second molar in front of it. Reason number 4, you could develop a cyst or tumor around the wisdom tooth. Sometimes a cyst or tumor can develop around an impacted wisdom tooth. This can lead to serious consequences, such as needing to have part of your jaw removed. Okay, so you decided to get your wisdom teeth removed. What bad things can happen if you get a wisdom tooth removed? The normal complications of getting a tooth extracted are a chance of infection or dry socket. An infection can happen if a piece of food gets stuck in the extraction site before it gets a chance to heal. This can be a serious complication if it's not caught in time. It can be life-threatening, and some people need to be hospitalized after getting an infection in a wisdom tooth socket. A dry socket is a condition when the bone in the socket is exposed following an extraction. It's not serious, but it's very painful. Check out my What is a Dry Socket video to learn more about dry sockets. Deeply impacted wisdom teeth may be close to the inferior alveolar nerve. That's the main nerve in your lower jaw, which runs into each tooth and also your lower lip. It's the main nerve that gets numb with anesthetic when you have dental work done on a lower tooth. If the wisdom tooth is close to the nerve, there is a chance that removing your wisdom tooth can cause nerve damage. In these situations, your dentist or oral surgeon will take a cone beam scan, also called a CBCT, to get a better look as to how close the tooth is to the nerve. If it's close, they may decide to perform a coronectomy instead of removing the tooth. A coronectomy involves removing the crown of the wisdom tooth and leaving the roots. Or they may wait a few years to see if the tooth erupts further. Here's a case of mine. This first x-ray shows the lower left wisdom tooth being close to the nerve. The patient didn't want to risk nerve damage, so he declined to get the wisdom tooth removed. A few years later, a new panoramic x-ray shows that the tooth erupted further and is now away from the nerve. I extracted the tooth at that point. So when's the best time to get a wisdom tooth removed? It's best to get them removed when you're young, for a few reasons. Early on, the roots of the wisdom teeth aren't fully formed. This keeps the roots away from the lower alveolar nerve, and it makes it easier to remove the wisdom tooth, since the tooth is smaller. Also, younger people have softer bone in their jaws. It's much easier to remove the teeth when the bone around the teeth expands easily. Check out my tooth extraction instruments video to see how I use various instruments to remove a tooth. And another big reason to get your wisdom teeth removed when you're young is that you can heal much faster. I've had patients in their late 60s who needed to get impacted wisdom teeth removed, and it took them several months to heal fully, whereas most people in their late teens or early 20s are fine in a couple of days. So who should remove your wisdom teeth? First, talk to your general dentist. Most will refer you to an oral surgeon whom they know and have worked with in the past. Some general dentists are comfortable with removing teeth, especially if the wisdom teeth are fully erupted or only partially impacted. There are even some general dentists out there who are comfortable removing full bony impactions. Personally, I'll refer out patients who want to be sedated for the extractions, or if the teeth are horizontally impacted. I'm comfortable with removing fully erupted wisdom teeth and soft tissue impacted teeth. So when is it okay to leave a wisdom tooth? So I'll leave a wisdom tooth in if the person has enough room for them to fully erupt and there's enough room for them to brush and floss them. Then I treat them like any other tooth. Otherwise, if the wisdom teeth are full bony impacted and the person is older than 25, I'll recommend leaving them and just monitoring them with x-rays. Most will stay like that and not cause any problems. And lastly, if the person is in their late teens and loses a second molar, I'll wait to see if the wisdom tooth moves into the second molar position to replace the second molar. It doesn't happen every time, but it usually works out well for the person. Anyone watching still have their wisdom teeth? Or if you had your wisdom teeth removed, how old were you? Who extracted your wisdom teeth? Was it your general dentist or an oral surgeon? Let me know in the comments. See you in the next video.